I'm very pleased to be able to discuss the results of the OpACIn-neo trial. This was actually first presented last ESMO 2018 and updated this ESMO 2019. And what we see is that patients with resectable but bulky stage 3 melanoma, ordinarily these patients would be treated with surgery followed by drug therapy for 12 months. But what we see in the OpACIn-neo trial is when we give these patients simply 2 cycles of combination Ipilimumab and Nivolumab, we induce a high pathological response. This is then followed by surgery in nearly 75% of patients overall. Furthermore, in those 75% of patients that have a pathological response after 2 cycles of drug, virtually none of them recur. And this is now with a median follow-up of around 18 months. Normally, this sort of population, 70 to 80% of patients would recur in that first 2 years. So this is a significant improvement in that 75% of patients are having a pathological response with drug, and almost none of them have recurred. In fact, only one who's had a pathological response has recurred. So this is very impressive data. What we think is happening though is that when we give the drug first as opposed to after surgery, we train the immune system better. So the T cells, our immune system, can recognize the tumor, and we induce more of a stronger immune response as well as a longer lasting immune response. The next steps, however, are now showing and proving that giving the drug first before surgery is better than having surgery followed by drug. So this would be a neoadjuvant versus adjuvant trial, and that's now in the planning stages. The other great thing we did present at ESMO 2019 was the biomarkers associated with this trial. And what we found is that patients who had a high interferon gamma signature at baseline, as well as a high tumor mutation burden, every single one of those patients had a pathological response. So that's 100%. Interestingly, if we go to the other end of the spectrum, the so-called less immunogenic tumors that had a low tumor mutation burden and a low interferon gamma signature, still 37% of those tumors had a pathological response. So what we see is that the combination of interferon gamma and tumor mutation burden is highly predictive of a good response. However, the absence of those biomarkers does not mean you will not respond. You still can.